At Washington Smiles, we're a group of doctors that are really good at coming up with solutions to help our patients short-term and long-term in their dental needs. I'm passionate about dentistry and treating patients because I feel like it is undervalued how important it is to your overall health. There's so many things in the mouth that I can see that actually alert me to the rest of the body. Like when your gums are inflamed, that doesn't necessarily mean you just have gingivitis. Sometimes it means you are diabetic, or you're almost diabetic, or you have an inflammatory disease that you don't know about, but maybe you're noticing some other things happening in the body. But we see in the mouth, because it's the gateway to the body, things happening and changing that we should make you aware of so that you can take that to your doctor.
My name is Aruna Rajagopalan. I grew up in St. Louis. I went to St. Louis University for undergrad, and I went to UMKC, Kansas City for dental school. I was originally pre-med, and I had taken all my science classes, but then I also dabbled in art. And I took sculpture, and I took drawing and painting in college, and it just felt perfect because I love to work with my hands, and I also love to help the community. So I think that's what inspired me to go into dentistry.
At Washington Smiles, we provide exceptional care. It's everything from the moment you call our office to when you come in the door.
When they walk in the door, they automatically feel welcomed, starting with a smile at the front desk. Everything from the assistant to the hygienist to the dentist, they always feel welcome with a smile on their face. And I feel like they feel like they're being listened to when they address their concerns, and we want them to feel heard, and we also want them to feel like they're at home.
You know, we do everything we can to keep our patients comfortable. We have the latest and greatest technology, everything from extra help reading x-rays to make sure we can catch things when they're really small. We offer 3D x-rays, which is great for knowing what tooth needs a root canal, if there's infection, if there's a problem, if there's enough bone for an implant.
If a patient has a toothache and we can't see clinically what is wrong with the tooth, or even with a two-dimensional x-ray, the cone beam helps us see more information that helps us diagnose effectively.
All of the things that make dentistry hard, by using 3D scanning and 3D x-rays, we can actually make it more efficient and make something really, really hard more predictable, and that makes it better for our patients. All of the doctors collaborating together, we can make dentistry more predictable. We are here to help you gain your confidence for photos, family events, and milestones.